Go.
Hello, my name is Linda Lee Bertrand. I'm the nurse practitioner in the heart failure program. If you're watching this movie, it's because you have heart failure. When you have heart failure, you frequently have symptoms of shortness of breath, your legs swell up, you can't lie down flat at night, and you can't do the things that you want to do because your activity tolerance is decreased. Now, we can change that by paying attention to your diet and keeping the salt out. Keeping the salt out of the diet will help to decrease your symptoms, decrease your weight, you will have less swelling, and you will be in the hospital less frequently. A normal American eats 4,000 milligrams of salt a day. We would like you to eat 2,000 milligrams of salt a day. Now that seems like a big deduction, but it's really easy to do. The first thing is to take the table salt off of the table. If you can do that and not put any salt on your food, you're saving about 1,000 milligrams of salt. So you're halfway to your goal. So instead of salt, what can you use? You can use spices. For instance, this McCormick spice mix has no salt. And if you go to the spice aisle of the grocery store, there are 72 different spices that you can use that have no salt and will make your food taste better. I have a couple of them here that you can see, and sometimes they make specialty ones for the different types of food that you like to eat. The next is to try to eat as much fresh food as you can and as less processed food as you can. For example, here we have some fresh carrots. These carrots, which you can eat raw or cooked, have 0, that means no sodium in them. As opposed to if you bought a can of carrots and you use 1 serving size, which is only a half a cup, you would be getting almost 400 milligrams of salt. So you can save a whole lot by eating fresh vegetables, and also frozen vegetables have almost no salt. Now, a lot of our patients like to eat soup. So if you buy a soup in a can, this one particularly has 700 milligrams. Some of them have as much as 900 milligrams. So this is not a very good choice because that takes up 1/4 of your day. What you can do instead is you can use a low sodium chicken broth, such as this Box, that has 5 milligrams per serving. So 5 milligrams versus 700 milligrams, you save a whole lot. And you can put any of these fresh vegetables in it to make the kind of soup that you want. Now, whole meals. When you're eating a meal and you buy something in a restaurant or something that's been cooked in a store, such as this chicken dinner, you get a lot of sodium. This particular one equals 1,350 milligrams because the chicken, the potatoes, and the peas have all been processed in some way. But instead, you could buy some fresh chicken at home and you could make your own dinner, like this one, that has only 100 milligrams because the chicken has not been processed, so there's only 100 milligrams in that, and all these vegetables, you could have the plate overwhelmed with vegetables and you will still not be getting any extra sodium. So you see, you can eat very good without adding extra salt to your meals. You can add other spices to make it taste good. And if you can do that and stay within the 2,000 milligrams, you will have less symptoms. Your heart failure will not get worse as quickly as it would with the sodium, and you will stay out of the hospital. Thank you for listening.